It's an election year in Bihar, and a few days ago, Nitish Kumar presented a 10-year report card for his government, speaking extensively about improvements in the health sector, particularly in reviving primary healthcare centers or rural hospitals, 6-bedded ones closest to villages that were mostly defunct before 2005. But as Alok Pandey finds out, at 3 different hospitals in a day, many major issues remain, including very few doctors and no supply of emergency medicine. Take a look at this special report.
3 hours after surgery for sterilization, Sona Devi is lying on the floor of the Maqsaur Primary Healthcare Center in Bihar's Nawada district. 18 other patients are stretched out near her. Patients considered more critical are assigned the 6 beds that the hospital offers. Each of Bihar's 500 rural hospitals like this one is expected to treat 50,000 people, as opposed to the national average of 30,000. Sona Devi pleads with the staff for water. Doctors tell her she can't have any so soon after the surgery. In any case, the hospital has no running water. Water is brought in buckets from 300 meters away. Post-surgical medicines for these women are meant to be provided at no cost. But doctors say at least 4 crucial drugs used in post-surgical care and painkillers have not been delivered for months by the government's health department.
बाहर से कुछ लेना पड़ा?
बाहर से लाया।
कौन सा? क्या दवाई कितना बाहर से लेना पड़ा? कितना पैसा लगा?
दर्द के लाया सुबह।
तो कब से ये पेन किलर की समस्या है?
2 माह से नहीं है।
2 माह से पेन किलर नहीं है।
टैबलेट है, इंजेक्शन नहीं है।
जैसे ऑपरेशन के बाद तो हमको लगता है सर इंजेक्शन की भी जरूरत पड़ती है
तो हम लोग परचेज करके मंगवा लेते हैं।
जैसे आपने जैसे पेन किलर नहीं है तो आगे आपने बताया नहीं, मतलब डीएम को जो भी आप
बताया हुआ पूरे जिला में इस तरह की क्राइसिस है।
The Bihar government says each primary health center, the 500 rural hospitals, either have or are within months of having 6 doctors in charge. There are 2 at this one. Bihar has just 30% of the government doctors needed for state-run hospitals. The national average is a shortage of 40%. 15 kilometers away at the Sirdalla Primary Healthcare Center, 28-year-old Ranjay Kumar says he's forced to lie out in the open with a drip because there is no room inside. Inside the hospital, it's the same story of patients on the floor, this time in unhygienic conditions. The Rajouri Primary Healthcare Center, 15 kilometers from Sirdalla, has 5 empty beds. The 6th is being used by Asha Kumari, admitted for delivery. The Bihar government says every patient admitted to its rural hospitals is entitled to 3 meals a day. Asha Devi hasn't been given any. Relatives have delivered meals to Asha Devi, but if she wants to use the bathroom, she has to wade through stagnant water to reach the only toilet, a stinking mess.
All the PSCs Prabhari have been directed that they should supply the medicines free to the patients. If there is any problem in those PSCs, I will look into it and fix a responsibility for the same on the MOICs. This is a state level problem. Actually, Medical Corporation was supposed to supply medicines to the hospitals, but tender has not been finalized at the state level and we are purchasing it at local level. Actually, we went for the tender, but nobody turned out.
In the last 10 years, Nitish Kumar's good governance agenda has had a major focus on health, particularly at the basic level, which is the level of the primary healthcare center. But on the ground here in Nawada, there is enough evidence to suggest that much more needs to be done and that many more improvements need to be brought about before the Nitish Kumar government can actually claim this to be a success. In Nawada with Ashok Priyadarshi and camera person Habib Ali, this is Alok Pandey, NDTV.